Hello, everyone. I'm Tracy, the Obesity Action Coalition's Director of Policy, Strategy, and Alliance, and thank you for tuning into this special episode of Fresh Perspectives. Today, we're celebrating Obesity Care Week, an annual public awareness event aiming to change how we care for and about obesity. One of the ways OAC is changing the way the world cares for and about obesity is through our advocacy efforts. OAC's top advocacy priorities are fighting for access to obesity care and fighting to put an end to weight bias and discrimination. So today, we're going to speak with a few of our fierce advocates. Welcome, Kevin from California, Amber from Tennessee, Sarah from Florida, and Ted from Pennsylvania. Thank you all for joining us for this conversation today. Let's dive right in. Can each of you tell us a little bit about yourself and what inspired you to become an advocate in the obesity space? Kevin, let's start with you.
Good morning, everybody. Well, I've been suffering from obesity all my life. I struggled with my weight all my life. I was inspired to become an advocate when I went to my first OAC conference. I believe it was in Washington. Yeah, it was in Washington, D.C. And I took a class, and it interested me. I was very interested in what they did, and they were very political, motivated, educational, and a lot of information. It was very different from the other weight loss organizations that I belong to. But the advocacy part meant a lot to me because it was enabled me to find a voice for myself, not only for others, but for myself. I was going through a period of time where I was everything. When I went to my primary care physician, everything was based on my weight. Your swelling for your legs is because of your weight, when it was actually lymphedema. And that's just one example. And I had to learn how to advocate for myself. So that's what got me started. And I had an opportunity last week to do some great advocacy work, and I could probably talk about that later.
Thank you. Amber, would you like to go next?
Hi, everyone. I'm Amber. I'm a former board member for OAC, currently involved in World Obesity Federation. I've been now an advocate for 14 years, but what really started my interest in sort of, I think what lit my fire was seeing some of the responses online. Really was just like a case of somebody getting care and not being, supported. So I really Googled the OAC if I'm being honest. But really, like, what kept me and what deepened that was my own journey with care. My experience with obesity care is that if you don't advocate for it, that you don't receive it. I'm maintaining a 245-pound weight loss, and I tell people all the time that the way my body looks, my weight is actually a reflection of care of obesity in this moment in time. And just seeing how difficult it is to get care when you want it, when we already have issues of access and bias and coverage. There's a myriad of things that we need to tackle, but for everybody who wants care, it is still difficult. So for me, that has inspired me to stay in the fight.
Thank you. Next, we have Sarah.
Hi, everyone. So how I became an advocate, of course, it goes back many years, as Kevin mentioned. I've lived with obesity since birth, pretty much. I think what really triggered my interest in advocacy is having to advocate for myself. I think we all have that story of maybe not the first time we went to the doctor and were not treated well, but for me, the first time I wanted to get help with my obesity and how it was treated. And actually, what's interesting is I didn't struggle to get coverage for the treatment of my obesity. There was issues and trying to advocate for myself to get the doctor to refer me. But once I was referred, I had coverage. And after I had that treatment, I was able to get my first full-time job in what I consider real insurance. And I was very excited about that. And then reality set in, and that insurance had an exclusion for obesity treatment, which I didn't think was going to be an issue because I had already received the treatment I needed. But like Kevin, I also have lymphedema, and I had my lymphedema treatment denied because I had still had the diagnosis of obesity. And it just struck me as wrong that this exclusion for obesity treatment was impacting treatment for other conditions I had simply because I had the diagnosis of obesity. And so that, really kind of got me riled up. And it was, I will admit, it was a few years later after I was discriminated against at my job based on my size that I officially joined OAC and really learned to be an advocate, and have, taken that advocacy to as many places as I can. But that's kind of really what riled me up, was seeing how these exclusions impact other health care that people with obesity receive.
Thanks, Sarah. And Ted, please.
I'm Ted Kyle. I'm from Pittsburgh, and I've been working in this area for more than 2 decades, working with OAC, serving on the board for a dozen years and as chair. And what really got me started goes back to those 2 decades when I started looking for insights into people's experiences with obesity as part of my job. And it was just unmistakable how much pain and difficulty and really harsh treatment people received because of living with the physiologic problem of obesity. And the more I worked on it, the more obvious it was that while there was lots of talk about being serious about addressing obesity, what was being done was really just pointing fingers at the people who were living with it. And my resolve that this needed to change just got stronger and stronger with time. That's really the roots of my involvement in advocacy, because I'm committed to the idea that we need to do better.
Well, welcome to you all. So let's kick into another question. This one will go to Ted and Sarah. In your opinion, what are the most pressing issues people affected by obesity face, and why do you feel it's crucial to address them?
Yes, I'll take it first in case Ted steals my answer. So, well, as I mentioned, I think access to healthcare is the most pressing issue. Obesity is a disease, and it's a chronic condition that needs lifelong management. And currently, patients don't have access to the treatment. But as I mentioned, some of these exclusions and policies are affecting patients' ability to get any type of healthcare. And being healthy or having being able to manage your health is key to other aspects of life. For children or young adults, it's key to education, going to school, going to college. For adults, it's key to being able to be employed. I mean, I'm not to say that people with obesity, take more sick days or whatever, but just being healthy enough. I'm actually currently, on disability because of mobility issues due to obesity and lymphedema. And so had I had better access to care earlier in life, I might not be at this point. But I mean, I think we all agree, like, healthcare is vital, and we don't get the same access to care, yet we are blamed for being a burden on the healthcare system. And that's just, the irony of that. Care is excluded in policies. Hospitals can't accommodate patients of certain sizes. It's just, we need to change that so we can live our healthiest lives.
Yeah, Sarah's absolutely right. And I really just would be inclined to totally endorse the priorities, Tracy, that you outlined at the beginning. It's all about access and it's all about bias. And the two are woven so tightly together because it's maddening to see how, at a time when nearly 3/4 of the population are living with either obesity or overweight, perfectly rational people can say, oh, what we've got to do is prevent this. Well, gee, the 25% who are unaffected are biologically resistant. So maybe you have to think about what you're really saying when you say that. What you're really saying when you say that is we're writing off the people who are already living with this condition. And the only thing that makes people able to do that is an implicit bias that says, "Oh gosh, they did this to themselves. I'd like to be able to help them, but it's really a lost cause." And people don't explicitly say that, but their actions say that, and it's very frustrating.
Those are all really important points raised. Next question to Amber and Kevin. Can you share a personal experience or story that highlights your advocacy work?
Yeah, I think I want to add on to the last question just a second, is that when we're talking about advocacy, I think when people talk about advocacy, it feels very like person who is living with obesity to decision makers. But advocacy can be self-advocacy too. And what Ted said about that implicit bias is why I believe is so detrimental in changing the way we treat obesity, is that people living with it start to believe those things about themselves. So when we would move differently, and if I went into a doctor's office with a broken arm and somebody told me I needed to um, eat less and move more, we would go, some flags would go off, right? Like there's this belief that it is a disease of choice, and certainly the decisions we make affect any chronic disease we're living with. But I do think it is rejecting those messages so that you can advocate for yourself too. But in terms of a personal story that highlights this advocacy work for me, like I think about advocacy, me to decision makers or people, either at like a system macro level. So I've been to DC multiple times, in person and virtual. I've had the opportunity to testify in state legislatures. Tennessee is a priority this year. We believe that we can expand TennCare to provide additional options for obesity care. So I'm excited to be working on that and visiting the Hill early in 2024 and throughout. But I think the things that have mattered the most to me are the personal messages I get from people who have said, "You've inspired me to talk to my doctor. You've inspired me to take this step." I'm really active on my Instagram, which is Obesity Care Advocate. I talk to people living with obesity all the time, and there's a weariness that people who are living with obesity have. They may be doing all of the right things and looking at their insurance policy, finding a PCP, maybe a bariatric surgeon or obesity medicine specialist, and they need to know that they're doing the right things. Or sometimes, they do need a little guidance, but it is almost giving people permission day to day that they are worthy of care that's delivered with dignity and respect, and just being someone that they can reach out to that understands what it's like to live that path. So for me, like the advocacy that stands out the most is the interpersonal connections I make through social media, but then also just never assume that someone else is going to speak up when you have an opportunity to advocate. So don't put it off. Take the time to take the action center alerts, put your members of Congress in your cell phone. When you have issues, you can call them, and build a relationship with people so they understand where you're coming from.
Thanks, Amber. Kevin.
12 years ago, I had gastric bypass surgery, and I successfully lost 220 pounds. And I started going to support groups at the hospitals and clinics and what have you. And I told my story and gave examples of my journey and started just spreading the word and what have you. And I noticed like people were listening to me, and I never thought I would be in a position where people would actually listen to my story. I thought, why is my story so, And I had this one lady, she grabbed me by the arm and she said, "You know what, you inspired me so much." And she just grabbed me out of the blue as I was leaving the clinic, and she said, "Your story is really inspired me and gave me the courage to consider having the weight loss gastric bypass to help her with her struggle with obesity. So fast forward to just recently, my biggest experience right now was OAC gave me the opportunity to go to Washington D.C. last week to speak to the lawmakers and encourage them to sign the TROA Act. And I that was an amazing, awesome experience for me. Like I said before, I didn't think that my story would really make a change for people, but I guess it can and it will, and I hope it does. And that's what it's all about for me. I just want to inspire, like, just be able to help, like, just one person able to know that they have a chronic disease, that it's not their fault, and there is organizations and there's people out here that will listen to you and will help you.
Thank you for sharing a little bit about your journeys. They are very powerful. So Ted, Sarah, and Amber, you all have been involved in advocacy for years. And Kevin, you have had a number of opportunities recently. So to the full group, have you faced any challenges or obstacles in your advocacy efforts? And what drives you to overcome them? How do you stay motivated and committed to your advocacy work, even when you're faced with setbacks? I don't know if anyone wants to kick us off.
Well, I'll shoot. The most challenging thing for me is the simple fact that it can be tedious. People do not change their mind about these things just because I said just the right words once. Darn. And in fact, when we were both or actually all of us, at an advocacy event last week, I heard something from a really smart Capitol Hill policymaker who said, about the time you get tired of saying something is the first time anybody hears it. And I thought, boy, is that not smart. And as an example, in Pennsylvania, really 6 years ago, I was recruited to go to a legislative hearing to talk about getting access to obesity medicines on the state Medicaid program. And this was legislation that had enthusiastic sponsors and got an enthusiastic hearing. The folks from the state Department of Health and Human Services were less than well informed and unenthusiastic. And so, I thought, well, that was a downer, but at least the legislators are positive. Well, it didn't change right away. In fact, time passed. Because I was at that hearing, I got invited to participate in a state health improvement plan that included obesity and included a lot of nonsense that really wouldn't do anything about obesity, but would make the people who were writing it feel good about themselves, about promoting virtue and personal responsibility. But I was able to speak up, and things changed in tiny increments, and over time it felt like I was watching paint dry, and so I recruited other people to join in the fun, and they did. And because they did, more voices made more difference. And this year, the State Department of Health and Human Services made a 180-degree change where they went from resisting this legislation to preempting it and saying, instead of eliminating access to obesity medicines as a possibility, restricting them altogether, we're going to make them preferred on the state Medicaid formulary. Could not have been a more dramatic change. It was their idea, and it was an idea that was promoted by some of the other folks who joined in the conversation. And that was just a lesson to me about how important it is to have many voices and to persist.
Thanks, Ted.
I think similar to Ted, it's this. I think the biggest challenge, or what I'm going to call it a frustration at this point, is that we have not passed TROA. I think there's this The science of obesity has evolved. The options for care have evolved. Um, but there's still like this acceptance of, I don't believe science. There's something morally wrong to me that there are options out there for individuals who are living with obesity, which can improve their condition, and they don't have access to it. That is, we find the resources for the things that we value in our country, and if we believe that we want to be safe and healthy, and compete on the world stage, if you do not address obesity, you don't ever get there. Then I think the other obstacles, which have all been true for many people navigating the system, have just been fighting with insurance. I was a self-pay patient for my initial bariatric surgery. I've had revisions, fighting $50,000 bills that came through by mistake. But really, it is that, in all things, despite all of that, I would say I'm somebody who has successfully navigated the system and can get what I need. And it feels, no, it's not only like a responsibility, but a privilege to be able to speak up and say, this is possible. We can develop a standard of care that I shouldn't be an outlier, to the comprehensive care that I've received. So, to me, it's about using the power and platform that you have to help other people.
Well said.
Amber kind of queued up what my answer was going to be. I think one of the challenges we've had to overcome is how long it takes for action to be made. And Ted mentioned this too. Sometimes the accomplishments we're making in advocacy are what we would call behind the scenes. And it's not a big, win, or even if it is something you share with others, they think, but the bill didn't get passed. And so, that can be frustrating. And when we need more advocates to share their voices, sometimes I hear people say, no, I've already contacted their office. They just sent me a form letter. What's the use of calling back? Well, because if you call back, you have at least a chance of getting what you want. If you don't call back, you're definitely not going to get what you want or what you need. But I will say that last week in DC, I saw that difference. I had been in meetings probably 4 or 5 years ago for the Treat and Reduce Obesity Act. Actually, my very first meeting with my member of Congress was 10 years ago in 2013. So I've definitely am in this for the long haul, but I've seen the successes, even if they're small, we are making them. And I just want to share that. So when we were in meetings last week and you would say, have you heard about this bill? And the staffers had heard about the bill. They said they were hearing from their constituents. They were interested in it. It was just such a more positive experience. I think that's because we have the medications now available, and there weren't as effective medications years ago when we were trying to pass this. But of course, there's another component to the bill of getting the access to healthcare providers that can adequately treat us in the comprehensive way that we need treatment, mental health or dietitians. We need a comprehensive care for this condition. And so, that I think that's a barrier we overcome, but I've seen that we've overcome it. And then just something more on a social society level. I know we joke about don't read the comments and articles on social media, but if you do scroll through the comments, how surprisingly there are people who get it. There are people like sometimes I read a comment and I think, that's awesome. And I don't even know that person. Who is that person? Are they involved in any of the organizations I'm involved in? Because they seem to really get it and they understand it's not the person's fault. And so sometimes reading those comments, the change that you see from years ago reading the comments to what the comments are now is really eye-opening. And I think it is an indication of how society is slowly but surely getting it, their understanding.
I'm glad that Amber and Sarah brought up the fact that the question about why hasn't the bill been passed has been over 10 years. That was going through my head a lot last week because when I was speaking to the lawmakers, the bill was well received. They all was aware of the bill. They all supported the bill. So, but I was wondering in my mind, why is it taking so? Why is it taking so long? And I know in government things take a long time. I work for county government in Riverside, California, and I know the process. I've been up to Sacramento and done all that stuff. So I know it takes time, but you have obesity is a known chronic disease. You have the new medications that are out. You have all the evidence out there that supports the cause, and it's been a while to get it passed. So that was a little, I won't say frustrating for me. It was a question in the back of my mind, and but I didn't want to really say anything, but say that out loud to anybody. So I'm glad you you two brought it up. But on a personal note, I've noticed that personally when I'm advocating, like for myself, for example, I brought up how I wanted to be considered for some of the new medications, and my primary care physician, who approved me for my surgery 12 years ago, he said, "You're not diabetic." I said, "Well, you told me that I was pre-diabetic, and I want to do something to bring down my A1C, and then I could lose weight. And I have some experience a little bit of regain." He told me that I don't prescribe that to my patients who are not diabetic, and he just basically shut down the conversation. And then I reminded him, I said, "Well, I had the surgery 12 years ago," and then he told me, "Well, yeah, you already did it the easy way. You just need to go back to less eating and then more exercise." So that really, that was not well received with me. And I was really shocked that he said that, but that just shows that a lot of people aren't educated. My own primary care physician, he needs to be educated, and he needs to be reminded that it is a disease, and it wasn't the easy way out. So things like that are frustrating still when I'm talking to some people. I've heard that here and there. That's a little bit frustrating in the cause. But the experience in Washington was very enlightening. Like I said, it was very well received. Everyone supports the bill, so hopefully it'll get passed very soon. They'll finally go through what it needs to go through to go on and get finalized.
Well, thank you. Each of your accounts is very inspiring and motivational. I think we have time for one more question to pose to the full group again. And that is, what does advocacy success look like for you?
I'll kick it off, I guess. Um, when someone tells you, like when the lady that reached out to me that told me that what you're doing is great, it's helping me make some decisions. I'm glad you're out here letting us know that it's not our fault, that it's a chronic disease, it's not our fault, and there is various ways to get treatment and support for our disease. And a friend told me when I was going through some personal struggles, they said, "Kevin, you're reaching out to so many people, and if you just change one person's life, that's enough right there. Just one person, changing one person." And I had to think about that, and it really he was right. It's the gratification of being able to change a person's life.
For me, advocacy success is really straightforward, and that future state, which I am convinced we will get to, is one where when a person is living with obesity, they can get care, and there is not even a flicker of thought that, wow, this person needs to do their part. Because when you seek care, you're doing your part. This is a disease that eventually we're going to treat just like we treat hypertension. We don't lecture the person that they've screwed up because they have hypertension. We just offer them care. And care right now for obesity, actual care, is all too rare.
Ted actually said it better than I was going to say it at the system level. I think there's also a for me, it has a lot of coming from a family of like generational obesity. I think a lot about what my daughter's experience will be like in the healthcare system. And so it is creating a better world for her. But that picture is just as Ted described. Um, but it is, though, it is like, and I like what Kevin shares, like, I cannot count the number of people who said, I would have never asked my doctor about this if I hadn't talked to you or learned about your story. It is like advocacy is creating change, but it is also inspiring people that it is possible. And that is so important to refuel you as you stay in the work, and know that it is going to be one person at a time sometimes, and that we do need to replenish ourselves because there are a lot of losses. There are a lot of like just disappointing outcomes, but we are making progress. Sarah's right about the comments and the evolution of the way people are thinking, and we just needed to go faster, and all stay in the work. And I think what we have done well as an organization at the Obesity Action Coalition and as an advocacy group is centering on the lived experience. So not tokenism when it comes to making sure we have voices or a pull-out quote or a glossy one-pager. We are doing the work. We are embedding our experiences about the outcomes we expect. We talk a lot about weight, but weight is a symptom of obesity, our body weight. Some people are seeking obesity care because they have other issues they want to resolve. It's beneficial to other medical conditions, but successful advocacy is having a system in which people can achieve the health results they want as it connects to getting their obesity treated. And sometimes that looks really different, and you only know by talking to people and including them in that process. So keep on doing what we're doing.
Thanks, Amber. And Sarah.
So, I mean, I have a pretty good example of what I think advocacy success looks like. As I mentioned, I've been working to get TROA passed for 10 years. It was in 2012 that I attended the first Your Weight Matters convention. And as Kevin mentioned, there's training opportunities at those conventions. And so I was advocacy trained at that convention. And as I also mentioned, I have lymphedema. And so there was also a lymphedema bill, Lymphedema Treatment Act in Congress. So when I first met with my member of Congress in 2013, I had information for both bills because I was ready to go. I'm affected by both conditions, and they kind of interact with each other, both making the other one worse. And so for the past 10 years, I've been trying to get both passed. And last December, the Lymphedema Treatment Act did pass. And so starting in less than a month, there will be coverage for lymphedema compression garments under Medicare. And so many patients like Kevin and myself who have obesity-related lymphedema, as much as it's not direct lymphedema or obesity treatment, it is treatment that's going to help patients living with obesity manage that other chronic condition that they have. It would help their mobility. I really think it's going to help overall in their health. And that success just makes me understand it is possible. I mean, it also took, that bill had been in Congress even longer than TROA had. And so, and it takes 10 to 12 years. Like that's the average to get a bill passed in Congress. And so it not that I lacked any confidence before getting the bill passed, but now that I successfully helped get it passed, I'm even more confident of what is possible. And especially what I heard in DC last week really does give me that confidence that we are going to have some successes in the obesity care space very soon.
Thank you. And thank you all for sharing your perspectives on what success looks like. And I think you leave us with a lot of hope. So thank you all for taking the time to speak with us today and for your hard work in making the world a kinder, more inclusive place for people living with obesity. Thank you all for tuning in. OAC and our advocates wouldn't be able to make the impact we do without your support. Plus, there are ways people at home watching this can take action right now. You can head to the OAC Action Center to take quick, easy, targeted actions like sending a letter to your state representatives, urging them to co-sponsor the Treat and Reduce Obesity Act. And you can head to obesityaction.org/action center or click on the link in the description. You can also support our mission by making a donation. Help us continue our work to raise awareness and improve access to the prevention and treatment of obesity, provide science-based education, fight to eliminate weight bias, and elevate the conversation on weight and its impact on health. Head to obesityaction.org/donate or click the link in the description. Thank you again. Bye now.